Just a bit more information on the circumstances of the outbreak. So today's locally acquired case is directly linked to the Stratton Finance workplace. And like many of the cases we are currently managing, this person was quarantining securely during their entire infectious period. As we know, we've seen multiple outbreaks driven by the different variants over the course of the last few weeks of the virus moving around our community. And here's where we stand for each of those different aspects of the outbreak as of yesterday. In the City of Whittlesea outbreak, we've identified 1,500 primary close contacts to that outbreak, and the Port Melbourne outbreak, we've seen 2,100 primary close contacts. These numbers are continuing to fall each day as people finalise their quarantine period. And as these numbers fall, so too do the list of exposure sites linked to these aspects of the original part of this outbreak. There are now fewer than 200 exposure sites online, and we expect as sites and primary close contacts continue to be cleared, that figure should continue to come down. In regards to the private residential aged care outbreak, the Arcare Maidstone location, where we've seen 1,057 primary close contacts. That number grew as a result of the case associated with the family member yesterday, and a number of his sites have been added as of yesterday. With the West Melbourne cluster, which is still moving and shifting. In fact, we've seen that number of primary close contacts grow to 1,112. Obviously, the majority of test results that continue to come in from the outbreak have given the public health team the confidence that they need to make these recommendations that the Acting Premier has just announced. But I should add that when we break down primary close contacts by outbreak, there's a degree of overlap for particularly the Port of Melbourne group and the Whittlesea outbreak. Some of the sites of recent concern that we've been looking at, I can advise that of the 490 contacts for the Pro-Build site, 442, that is 90%, of that site have returned negative results as of yesterday, and we'll just run down the last few over the course of the coming time. There was the jewellery cluster of organisations at 227 Collins Street. I can advise that of the 53 contacts there, 46 have returned negative results as of yesterday. That's running at 87%. Of the primary close contacts linked with the primary school, we've identified even though the numbers have increased, once the initial group of primary close contacts was identified at 865, 558 of those have had negative tests received. But as that number grew yesterday, we will expand that testing regime yesterday and today, and we will expect those numbers to come in. So we're continuing to work through the clearances of the primary close contacts throughout this outbreak in the many, many thousands, and those people are increasingly getting to the end of their quarantine period. I just want to express our great thanks to that group. They have done it really extensively on our part, on behalf of us all, to take the hard steps to keep themselves quarantined, to keep themselves safe, but to allow the public health officials the certainty to know that this virus isn't circulating as a result of them circulating, and to give us the confidence that increasingly our public health teams, our contact tracers, can test, trace and isolate and break those chains of transmission. And can I thank you all for taking the extraordinarily challenging steps you have of having isolated over the last 14 days, or indeed as your period of quarantine continues for those who are still in quarantine. I just want to put out a call today, as we've been doing every day for the next few weeks around getting tested. We've seen huge responses for the testing call-out that we've made over the last few weeks, and we've seen unprecedented levels of testing numbers and the continuing high turnaround of those pathology results within 24 hours in a day to meet, if not exceed, the national standards. Those tests are so important, particularly as we enter the winter period, particularly as we enter the high risks period that goes with winter, with still, as part of the national rollout of the vaccine program, even though we're ratcheting that up, we still have very low rates of full vaccinations. So being tested is so important, particularly until we build up that higher level of vaccinations. I would just stress, as we have been over the last few days, the most important thing you can do with the earliest onset of sniffles is don't go to work,